An approach to healthy weight treatment first and foremost includes setting treatment goals and weight targets with your dietitian and physician. Now, you need to understand that you may have had significant weight changes since your diagnosis with IBD. So it may not be realistic for you to aim for your pre-IBD target. Therefore, having a clear rationale as to what is appropriate for you is something you should discuss with your treatment team. Now, when being underweight or having lower muscle mass, optimizing your food intake first orally is always the priority. And this can be achieved by including or incorporating small, frequent meals throughout the day rather than larger meals at designated time points. A preference for liquid and or pureed or softer foods frequently is better tolerated, particularly when having obstructions or blockages in the gut. And when having active inflammation, having a nighttime meal or a meal that's richer in protein and complex carbohydrates before bedtime can be very effective because it minimizes the overnight fasting period when protein breakdown or protein catabolism can occur. Now, in terms of what to eat, having an emphasis on protein-rich foods, complex carbohydrates, particularly fruits, vegetables, grains, and legumes, is important. Incorporating adequate amounts of soluble fiber, aiming for between 25 and 35 grams daily is important, as well as an emphasis on healthy fats, such as monounsaturated fats, and aiming for optimal omega-3 to omega-6 ratios, as well as decreasing saturated fat intake. Now, many patients with active inflammatory bowel disease may not tolerate fruits or vegetables, particularly in raw form. So please speak to your dietitian about strategies to improve the texture by peeling skins, removing seeds, perhaps gently sauteing or cooking or exposing your vegetables to heat, blending or pureeing them so that you have the optimal texture that you can tolerate and still retain these important nutrients, which may be important to managing inflammation. Finally, I'd like to talk to you a little bit about exercise and physical activity. Physical activity is an important component to include into your lifestyle together with dietary principles. And physical activity is both important for the underweight, malnourished patient, as well as for the individual that has overweight and or obesity. Physical activity builds muscle mass, and muscle mass is important to improving all those adverse complications we talked about previously, as well as improving quality of life, decreasing fatigue, improving sleep quality, and improving mental health. When having obesity, physical activity can decrease that fat in and around the organs, the visceral fat, and that can have important impact on decreasing overall inflammation to help improve the course of your disease. Physical activity can also improve the gut bacterial profile or the microbiome, as well as the circulating cytokines or pro-inflammatory markers that can perpetuate disease. So please talk to your doctor and your exercise specialist about how physical activity can be incorporated into your daily routine. So in conclusion, I'd like to state that maintaining a healthy weight in IBD is important for a number of different reasons as described in this presentation today. Please discuss your concerns around malnutrition, low muscle mass with your GI physician and or dietitian. And a multidisciplinary team is optimal to provide you with the adequate resources that can support you through this journey. With that, I'd like to thank you for your attention and for having me speak to you today on this important topic.